Well, advocates for heart health are painting the town red today, all for the American Heart Association's Go Red for Women campaign. Heart disease was once considered a man's disease, but we now know that it is also the #1 killer of women.
We are really stepping out and understanding that what we might have passed off as stress and anxiety are really symptoms of heart issues.
Go Red for Women began as a small gathering, but now has grown into a huge movement, pushing women to listen to their hearts.
In the past 10 years, we made women more aware. They need to screen themselves. They need to know their numbers, cholesterol, blood pressure, because they're taking care of everybody.
According to doctors, it's vital to know your numbers, cholesterol, blood sugar, and blood pressure. You should start checking these yearly, starting at age 20, and possibly more often if you have a strong family history of heart disease.
Blood sugar is very important because that causes inflammation of the walls of the arteries. High blood pressure has a negative effect on the walls of the arteries, and cholesterol certainly is the product that gets within the walls of the arteries and causes that narrowing of the blood flowing chamber.
It's also important to know that women present very subtle signs of heart disease and heart attack.
It can be an uneasiness in the chest, it can be back pain frequently between the shoulder blades, pain in the back of the neck, tingling in the arms, shortness of breath, fatigue. All these symptoms that aren't that crushing chest pain can be related to heart disease in women, and they should not take those symptoms lightly.
Of course, we have links for more information on WAFB.com.
Today, it's Go Red for Women. It's all to raise awareness of heart disease in women.
Now today, the River Center, it was packed for the Go Red for Women luncheon. It's hosted by the American Heart Association. There were free screenings to check things like cholesterol and blood pressure. There was also a silent auction that raises money for the organization and heart disease research. But the #1 goal here is to help women take charge of their health.
And the power of women, you know, is pretty powerful. And so I think we get out and we're able to really influence our families and communities.
You know, heart disease remains the #1 killer of men and women, and taking around 600,000 lives. That's nationwide every year.